So welcome to the World Extreme Medicine podcast with myself, Ryan Walker. In this episode, we're going to be speaking with Karen O'Neill on the current Ukraine crisis. So Karen is an advanced clinical practitioner in emergency care and an experienced humanitarian. She's divided her career between emergency medicine and nursing within a department within the north of England and the humanitarian sector. She's also an established member of the World Extreme Medicine faculty. Karen has experienced various number of deployments within disease outbreak and control and disaster response. Some of her projects include working as an emergency nurse at sea on the Save the Children Search and Rescue Migrant Crisis Response Programme in the Mediterranean. She's also worked in West Africa in the Ebola crisis, working as a medical advisor for the UK National Ebola Response Programme, providing assistance in Sierra Leone. She also, in the wake of Typhoon Haiyan, responded as part of the UKmed, or the UK International Emergency Trauma Register it was at the time, providing emergency medical care to populations living on remote islands that had been injured during the disaster. So she's worked both in hospital settings and community outreach posts in Uganda, as well as working on programs delivering primary care to slum-dwelling communities in Mumbai. So in addition to this, Karen has enjoyed leading programs in pediatric care in a hospital in Malawi, which is where we first met. And she's also continued to support a charity that assists children with chronic and ongoing illness needs in southwest Uganda, as well as advising on rural outreach health programs. So Karen, welcome to the podcast.
Thanks, Erin. It's nice to be with you.
So what we wanted to do tonight really is just look at the evolving crisis in Ukraine, the displacement of IDPs, so internally displaced peoples, but also just how to, from your experience, how to get it right, how you've seen sort of navigating the troubles, navigating some of the areas and problems which you've seen in the past, and how to maybe going forward we could look at approaching humanitarian aid to look at lessons learned. So maybe if you could just speak to some of the humanitarian emergencies that you've been deployed to in the past, and sort of maybe some of the meta themes you've carried forward, Karen.
Yeah, so I've had quite a mixed experience, really. So my initial experience was working on development projects in Uganda. That was in hospital and outreach. And that sort of gave me a really good foundation. And then I've since sort of had quite a mix of responding to sudden onset disaster, which was Typhoon Haiyan in the Philippines. And that was working with the British Navy and Save the Children, delivering primary care to remote islands. So that was, quite a mixed experience, really, because that did incorporate some public health response as well. And then that's sort of been carried over in the work that I did during the Ebola West African crisis, which I worked with the organisation UKmed that was primarily focused on the Ebola crisis in Sierra Leone, which is, hugely a public health response, as well as the acute provision of care in Ebola treatment centres to patients. And also then working with migrant and refugee populations in the migrant crisis in the Mediterranean. So these are predominantly populations that were travelling across Africa through Libya and boarding boats heading out into the Mediterranean. So then bringing populations back to Italy for their ongoing journeys. And then, from that, I've been involved in various humanitarian trainings and been ready to deploy to different disasters. So sort of quite a mix, really, as well as sort of the consideration of deploying to more hostile environments, such as, more countries affected by civil war or, situations like we're seeing at the moment in Ukraine.
So Karen, that's a fantastic mix of experience, actually. So just come back from Hungary myself, and at the moment they're receiving approximately 20,000 IDPs or indeed refugees per day across the border, and through Budapest and out the other side. Could you maybe speak? It sounds like you've seen a whole meld of experience in treating displaced refugees and peoples. Could you maybe speak to some of the lessons learned from sort of stewarding groups and or maybe how to provide an essential response to massive groups of refugees that are moving from war-torn or indeed natural disasters?
Gosh, the needs are, it's hugely complex. I mean, we're looking now in the Ukraine, I think the World Health Organization in their most recent situation report, they're projecting that 18 million people are going to be affected by the conflict in Ukraine. This is a huge number of people. And I think the numbers are something like 4 million people looking for refugee status in surrounding countries and beyond. I think it's sort of 6.5 million people are going to be internally displaced. You're talking about huge populations here. And that's just the numbers that we're seeing as potentially reported, in these ongoing conflict situations. One of the huge challenges is that, we don't necessarily get the most reliable information because, particularly from the most impacted areas, the information that's come out is slow, unreliable, and communication lines are down. So we don't necessarily get a true picture of what's going on. And that's when we've got, the expert agencies that are going in that are trying to do these needs assessments on the ground to find out what's going on. And I think, even just people trying to leave countries and just gain refugee status, people don't leave a country and they're suddenly given refugee status. And this is very much something I learned from working with Save the Children on the migrant crisis in the Med. For some people, it can take them years to get refugee status and to get the official papers. And they can be in countries for years on end and actually be asked to leave, particularly unaccompanied minors, once they reach 18. Obviously, it very much depends on the countries that they're in, but they can have their status rejected and be deported. So, sort of having this refugee title can be quite confusing in itself. And it can be quite destabilizing for an individual because their status, isn't necessarily secure. So, that's very difficult in one respect. And then, you've got the other problem of internally displaced populations. So people are displaced from their own communities. And I saw this hugely in my work in Uganda after the civil war in Uganda. People had left their communities. And it's even things like moving within countries. The language, the dialects can change, the language can change, the needs, the cultural experiences. They can be temporary camps that set up that suddenly, they grow and grow and grow. This was huge in Uganda and again in Sierra Leone. That these sort of internally displaced people's camps become permanent camps. But then authorities at some point might say, well, actually, no, you were never a stable settlement. It's time to close up this settlement. So the issues are complex. And then internally displaced persons camps or settings, you have multiple complexities within those environments as well, in terms of overcrowding, shelter, water and sanitation and hygiene needs, and health needs on top of that as well. So such a complex situation.
So, Karen, we were talking offline about coordination efforts and how difficult it is to coordinate. I think a seminal piece of learning from the Haiti earthquake back in 2010 was the lack of coordination and need for coordination on the basis, as you were saying, of a robust need analysis, that there would be certainly this collaboration between different agencies to ensure that the need assessment was both accurate and then being fulfilled in a coordinated fashion. So having had Mark Hannaford and colleagues be in Ukraine recently and come back through the Polish border, they speak of a really united and coordinated efforts on behalf of ICRC, on behalf of some of the other aid organizations, which almost provided a physical corridor of food, of clothing, of shelter, and logistical efforts on the back end, so that they're equipped with almost all the Maslow's hierarchy of needs at the base, and then the potential to move to different countries. But again, that's not uncomplex from a perspective of what different countries will ask as a prerequisite for entry to different countries. So that's still quite complicated. I know within Hungary and within Budapest, they were providing buses directly through to Germany, so non-stop buses from and then in Budapest Central train station, there was food stations, there was clothing stations, there was medical care stations, and they could get on buses straight through. From your perspective, Karen, how do you see the coordinated efforts playing out so far?
I think from what I've heard so far, there's been some good collaborative efforts. And I think, we could be really proud of, the WEM convoy that actually went over and delivered supplies, and seeing their coverage. It looked like people were really drawing together, and, that makes you proud to be part of that. I think what is very different in Ukraine is I think there's huge global outpouring and support and sympathy, and the whole world is really trying to unite to help right now. And it's heartening when you see these images that people are disembarking trains, and people are welcoming people. People are opening their homes. This is an absolutely incredible united effort. What you do generally have in any kind of humanitarian crisis, be it a conflict like we're seeing now, or a non-set disaster, or a more protracted crisis, you do have the United Nations cluster system of humanitarian leadership, coordination and strategy. Now, I think there's a big impression that in a humanitarian disaster that aid organisations and UN bodies of all unite, have this extremely coordinated effort, and also help each other out greatly. And it's not to say that doesn't happen, but I think often with the best intentions, responses to any crisis can become quite uncoordinated. The UN system, there's various domains to it. And so, for example, the health cluster is led by the World Health Organization. Then other clusters, for example, include education, which will be led by UNICEF, child protection is led by UNICEF, nutrition, which is led by Food and Agricultural Organization in conjunction with the World Food Programme. You've got camp organisation, security. So there's various elements to that. So what should happen, for example, under the health cluster, is that everybody that's working on a health response should report into the system. For example, people should be reporting what they're seeing and what they're dealing with. It should enable health mapping. It should enable disease surveillance and control and various aspects. But quite often in these responses, so many aid organisations respond with the intention to help. But when you get so many humanitarian actors involved, things can often become quite uncoordinated. And one organisation doesn't necessarily know what the other's doing. They're not necessarily talking to each other. Yet the intention is that people will do that. There's been a huge move. As you mentioned, there's the Haiti earthquake. there's been evaluations right back to the Rwanda genocide in 1994 that sort of raised issues of humanitarian coordination, particularly from the medical fraternity, about providing a standard of a response. And there were errors made, particularly in the cholera outbreak, which probably contributed to increased mortality and morbidity rates. So sort of people going with the intention of helping maybe actually didn't quite have that impact. Mistakes again were repeated in the Indian Ocean tsunami in 2004, and the evaluations that came out of that echoed the evaluations that came out of the Rwanda genocide evaluation. And again, like you mentioned, in 2010, following the earthquake in Haiti, these mistakes were made again. And I think, they sort of termed that the republic of NGOs, of non-governmental organizations, because so many aid organizations turned up to help. That, at one point, I think one of the evaluations for that disaster said that the number of surgeons outnumbered the number of patients at one point, or people didn't necessarily arrive with the correct skill set or with the correct equipment to deal with crush injuries like you see in an earthquake. So out of sort of these, we've had quite a lot of learning. And what at the time was the WHO's initiative of foreign medical teams, which is now called the WHO Emergency Medical Team Initiative. And what this is about is trying to bring on a more coordinated response, which we did actually see implemented better in the Philippines in 2013 following Typhoon Haiyan. So this initiative asks countries to report what facilities and what skill sets they have available on an emergency medical team, and what level of care they can provide, whether it's the highest standard, which is going to provide a full hospital with intensive care facilities, or it might be down to providing mobile outreach clinics. And you report what you have available. The impacted country can see what's available, and then they can invite countries in according to the need. So instead of people just turning up saying, with the right, with a good heart and, with driven by altruism, they want to help. For example, they're a healthcare professional. They really want to help. It might not be that their skill set is required in that emergency. So the EMT initiative is that you are invited in, your team is invited in, because there's a need identified. And, hopefully that's what we'll see now. You can see those reports actually on the WHO website, and it does make for interesting reading.
So Karen, from your experience, so how difficult is it in reality to sort of get help to some of these people that remain in Ukraine? And I suppose on the back of that sort of question, you see reports that ambulances being shot at, that there's healthcare workers in danger of injury and mortality. Sort of, what's your thoughts on both passage of aid to source, but also maybe the safety of an in-country response versus maybe a border response?
It's a really difficult situation. The situation overall in Ukraine continues to deteriorate. It's a huge country, so we know largely it's the eastern aspect of the country at the moment that is, predominantly most affected, and that's where the needs are greatest. It's a constantly evolving and dynamic situation. Entering a conflict zone is very different, for example, to entering, a country that's impacted by an infectious disease outbreak or a sudden onset disaster. So it makes the situation very fragile, very unpredictable. And that brings with it another level of training required to enter these countries, because really, it's best, if possible, that you've had the correct training to enter hostile environment. So, for example, you've undertaken the HEAT course, the Hostile Environment Awareness Training course, which actually prepares you and certifies you to work in a hostile environment, such as a conflict zone. And that also, it adds another complexity to your willingness potentially to be involved in a response in country in a conflict zone, as opposed to maybe working in a bordering country where, there's never any guarantees of safety, wherever you work in the world. But to enter a conflict zone to work is incredibly difficult. And we know that the areas of greatest need are actually the most difficult to access. We've seen only last week the Red Cross trying to make safe passage out of Mariupol, and there's been no guarantee of any ceasefire to get people out, and every time we think that's going to happen, the situation becomes more unstable again, and these populations are trapped. It's a horrific situation, and there is no guarantee now that working either within a medical setting, working in a hospital, or being a healthcare personnel, it doesn't guarantee your safety. And again, there's been huge calls. We've seen globally. We've seen it in Syria, for example, where there's been increased attacks on healthcare services, and this has resulted in injuries and deaths of healthcare workers, and that makes the situation more difficult again. I think, off the top of my head, I want to say that I think that there was, and these are the attacks that were reported, that over the period of 1 year alone, I think there was something like 82 attacks on healthcare services that resulted in approximately 43 injuries and 70 deaths, and that's in 1 year alone. So you can't guarantee, just by the fact that you work in a healthcare facility, that you're safe. And this has been another initiative that's been launched about the attacks on healthcare workers, the Attacks on Healthcare Initiative. It's a global initiative and global campaign to try and reduce incidents. But we have to accept that as healthcare workers, we're taking a substantial degree of risk, as are the people, the Ukrainian healthcare workers that are facing this on a day-to-day basis. And these might be attacks on healthcare facilities. They might be attacks on transport services associated, on evacuation convoys, on patients, on supplies, on warehouses that keep supplies, and even simple things like the power supplies to medical facilities. And that, we've heard that's been a problem in Ukraine, and that can impact simple things like your ability to run ventilators, or to be able to use your oxygen supply, particularly if you're relying on oxygen concentrators. So there's all sorts of complexities that come with that.
So looking at sort of second order effects of war, Karen, so as you were saying there, it's not an uncomplex environment really around just the application of healthcare, the safety of healthcare workers, but also looking at maybe access to clean water, sanitation, ongoing medication, and sort of supply chain issues. Could you maybe speak to some of the second order effects from your experience in humanitarian environments that you've experienced in the past?
Yeah, absolutely. Because I think initially we all sort of think about the acute care injuries, don't we? We think about conflict-related injuries and trauma injuries, and obviously they're fundamentally important, and that they're addressed. But then you've got the further impact. We're seeing reports at the moment coming out of Ukraine about the impact on maternal and newborn health services and child services. And, this gives a huge rise, for example, disruptions in antenatal care, which then results in increased risk of obstetric and neonatal complications, the ability to manage these complications. And then, you've got disruption to chronic health services. So people, for example, that maybe rely on dialysis, people that require access to mental health services, access to regular prescriptions, access for people with diabetes to some, the drugs, life-saving drugs they need, insulins, respiratory disease, you need inhalers, as well as the impact that the conflict's going to have on people's mental health anyway. It makes the management of chronic disease very, very difficult. And then, like you mentioned, you've got the impact on the water and sanitation and hygiene facilities. We're already hearing that, children have been dying of dehydration, and that just shouldn't be happening because of no access to clean water. And that situation is going to deteriorate in areas of poor access. And with that, you've got the risk of food and waterborne diseases. And we already know back in 2011, I think it was in Mariupol, that there was a cholera outbreak. So that shows there is a real risk of those diseases further down the line, as the water and sanitation facilities deteriorate. We see, I think it's in one of the Polish reception centres, there's already been an increased incident of diarrhea and vomiting outbreaks. And then there's risks to do with vaccine preventable diseases. So we know that overcrowding in populations, for example, in IDP camps, is a real risk of measles. And obviously with facilities not being able to deliver, essential childhood vaccinations, that then increase the risks of things like measles, or, when you get the suboptimal vaccine coverage, and the re-emergence of things like polio can prove a real risk as well. And then the risk of vector-borne diseases, as the springtime temperatures rise and, it gets warmer towards the summer. There's a risk of West Nile fever in the regions, and tick-borne encephalitis. And then also, poor shelter, poor housing, the increase of respiratory diseases, the risk of food security and nutrition, the disruption to markets and food supply chain, damage to agricultural infrastructure from the conflict. And in the Ukraine, for example, the rates of exclusively breastfed babies are quite low. So there's quite a large reliance on formula. And, that's going to be complicated further when you've got the risk with no access to clean water, for example. So the impacts are huge. It's not limited to just what I'm talking about here, but the impacts are absolutely profound.
So looking at because there is a lot of goodwill not only within the countries in Europe, but countries from North America and otherwise, giving aid and or time. And there's a lot of goodwill within the medical sort of professional, different careers, but also different pathways, and people want to both provide their assistance and volunteer. How best can they be involved within the sort of coordinated efforts, to your mind, Karen?
Yeah, it's a key point, because sort of having well-trained and effective performing staff are pivotal to success of any humanitarian medical intervention. And it's not necessarily possession of a medical qualification isn't always enough. Despite being driven by altruism and great intentions, preparatory neglect, for example, to go and work in these environments is a failing. And I've heard a lot of stories and had a lot of questions surrounding people wanting to collect up donations of medical equipment and supplies like blankets and clothing, and put them in a van and drive them over to bordering countries or enter the west of the Ukraine. And whilst that's good intent, people are doing that with great intentions, it might not actually be what's needed. So the best way is to try and go with an established agency. You've got the established agencies, Medicine Sans Frontières, Save the Children. You've got 15 organisations that the Disaster Emergency Committee are supporting. Trying to find an established organisation and actually speak to an organisation that's on the ground, and they'll tell you they want your skill, they want your help, they can tell you what donations they need. The WHO has a website that actually lists the requirements of medical donations that are actually needed within Ukraine right now. We have to remember the Ukraine actually has highly skilled healthcare workers, and they have some very good functioning hospitals that are unaffected at the moment by the conflict. And some of the needs assessments that are coming out now is that those medical professionals within these environments, they're saying, what they need right now is supplies, not personnel. So it's actually looking at what is on those supplies lists. And I actually found it quite interesting reading. It might not necessarily be what people think. I think people think, oh, we need to send dressings and we need to send medications. And it's not to say those things aren't needed, but actually, they need defibrillators, they need traction splints, they need surgical kits, infusion pumps, mobile X-ray facilities, ultrasound equipment, and they actually specify standard they need as well. So I think it's really important as a medical fraternity that we acknowledge the standards they want, and we actually listen when the skill set that's being asked for, that we have the right skill set. This is going to be likely, a protracted crisis. So it might mean that, right now they might need more healthcare professionals that work within child and maternal, their background is maternal and child health. It might be a trauma skill set that's required right now, but further down the line, what we do have to remember is that people undergo trauma surgery and, they have these horrific injuries. There's going to be a huge rehab need. So we can't forget those other skill sets that are going to be needed maybe further down the line. We might need our infectious diseases specialists further down the line. So it's not sort of all trying to jump in and help right now. It's actually sometimes taking a step back and listening to the professional agencies that will tell you what skill sets they need, and what equipment and support they need right now.
So Karen, you speak to this sort of this protracted, ongoing conflict, which certainly Ukraine is looking like it's going to turn out to be very much more protracted, and with maybe multiple deployments from actors and or funded organizations like UKmed. Could you maybe speak to your experience of deploying in such a team and your experience of maybe not just practicing your subspeciality, but your innate capability to sort of interact within a team and the team dynamics and being a team player and having to be, I suppose, in a way, more of a generalist than a specialist in what is, like you said, proving to be a very dynamic and complex and drawn out conflict?
Yeah, so my experience has largely been about waiting to be invited in to a country and actually responding to needs assessments. So needs assessments will specify, as they say on the tin, what's needed. And, these are absolutely fundamental. It's working with the Ukraine Ministry of Health and working with the healthcare workers and populations that are within the Ukraine and within the bordering countries as well. They will tell us and work with us to establish what we need. So, for example, there are needs assessment tools that are available. So it's not going in with your own tool, it's going in with established tools and matching what is needed. And you very much in many different crisis situations will find people speculating what they think is needed. And that's where things can go a little bit wrong. And again, this is all well-intentioned. But I've had the fortunate experience where I've been on a team where the skill set has been what's needed. Or on one particular team, for example, in the Philippines, we actually ended up splitting into two teams. One team working on primary care outreach, and the other half of the team actually joining the Australian emergency medical team to provide more of an orthoplastic platform. And, team dynamics are always very, very interesting. And I think you very quickly gel. You have the time of trying to all suss each other out. You often get some very strong characters, and you'll get people that are more reserved. And I think it's always trying to work to what each other's strengths are, as opposed to sort of trying to identify each other's weaknesses. And I think, you very quickly gel as a team. You have to be very, very mindful of working within your scope of practice and working within your registration. Because just because you're in another country, it doesn't mean that your registration from the country where you are registered isn't applicable. For example, my background is nursing. I'm a nurse prescriber, and as advanced clinical practitioner, I prescribe. However, in some countries, nurse prescribing is not a recognised qualification. So it's actually knowing the scope of practice for your role within the Ukraine or within the bordering countries, so that you are working within your remit. But that's not to say you don't approach your role with a degree of flexibility. It doesn't matter whether you've gone to work as the nurse, the paramedic, the trauma surgeon. It's being flexible and willing to pick up a mop if things need, cleaning down. It's packing up kits, it's unpacking kits, it's, turning your hand to anything, really, and willing to be very flexible. And I think you do have to be very flexible in your approach in humanitarian aid, because situations are so fluid, they're so dynamic, they're so, they can be changing, they can change 1 hour to the next. So I think you have to go knowing that is how things might be, and that you're really willing to pull together as a team. And I think if you go with that approach, I think you're already on to a winner.
So, Karen, as we've spoken about before, these undifferentiated attacks on healthcare workers and on press and media, which just kind of illustrates that there is almost a lack of differentiation between what constitutes the enemy and what doesn't. And as you said, as an analogue of that, we've seen maybe very similar in places like Syria and Iraq in the past. And there's reports as well coming from press that those that have been attacked, have had some significant mental health issues on the back of that. So some reporters that have been shot in various places. Could you maybe speak to stewarding your own mental health in these acutely stressful environments, and also through the passage of time having to be almost on high alert in these resource poor environments for extended periods of time, and maybe indeed how you've stewarded your own mental health through these incidents?
Yeah, I think you have to really think about your own well-being before you travel. And it's a conversation that I'll often have with my colleagues that I'm going to be working with about looking after each other as well as looking after yourself. I think we all arrive with a great sense of motivation and enthusiasm to help, and there's very much a willingness to sort of work 24 hours a day, 7 days a week, which we all know is unsustainable. So one of the key things is actually adhering to rotas, clinical rotas, not pushing beyond, willing to work every hour that you're there, but actually, working to schedules, looking out for each other, telling people what to look out for in yourself, so that, you and I might be on a team together and you sort of come over to me and say, Karen, you're not, you look like you're struggling today, and, giving people that opportunity to say, actually, I am. It's thinking about how you might deal with a difficult situation before you go. Your coping mechanism at home might be to go out to the gym, when you've had a difficult day, in the emergency department. That's not going to be the case when you're there. You might not actually be able to leave the compound where you're staying. So you have to think to yourself, well, actually, is it going to be that I can just go and listen to a yoga podcast, and just, sit in a quiet space? Is it going to be a good book? Is it going to be that you're going to journal? I've always found that talking with my team, just saying, I found this really difficult today. And it might not be something that somebody thinks is immediately difficult. It might not have been the huge trauma case that you were dealing with, or, the death of a patient that you were looking after. It might be something really small that's really triggered you. But it's actually then being able to speak with your team. And I found that really, really helpful, being able to debrief at the end of my day. It might be somebody else says, I really don't want to talk about it. It's actually just thinking in advance, you are going to be in a highly stressful environment. Things are going to be unpredictable. And what are going to be your coping mechanisms? I remember on one response, a fellow colleague gave me a bag of jelly tot sweets and just said, when the day gets tough, have a few. And it was so true. Just having 3 jelly tot sweets of an evening, or at the end of my shift, it was just a moment, that just was so simple, but helped me so much. And it, that might sound like the most ridiculous example, but that really helped me, because that person had the insight before I left to say, this might help, it helped me. So, I think really thinking in advance what is going to help you, so that you've gone away with those tools to know what will help you in advance.
So looking at some of the clinical need and the sort of the profile of injury patterns that there might be currently within Ukraine, it seems to be predominantly blast and ballistic, but like you said, lots of second order effects as well. So a lot of elective surgery and or chronic pathology, which isn't necessarily being stewarded or looked after in the same regard. Could you maybe speak to deployments you've seen in the past around blast and ballistic injury pattern, and what that does to hospital resources and indeed sort of staffing and clinical decisions when you do start to get an overwhelming number of cases in from sort of blast and ballistic or gunshot wounds?
Yeah, I can't speak from personal experience of working in a conflict zone, because I haven't deployed to a conflict zone. I've been prepared to deploy to a conflict zone, but speaking with colleagues that have been in those situations, I think capacity is a huge issue, because dealing with these injuries can require a lot of theatre time, can require a substantial team, And it's not just the initial trauma surgery, it's maybe not one operation, it might be multiple operations. And then there's the ongoing care, it's the wound care, the potential wound infections and complications that can arise afterwards. In the Ukraine, antimicrobials are commonly available over the counter. So it's already a country that has a high level of antimicrobial resistance. So aspects like that need to be taken into consideration, which might complicate wound healing or, with the use of antimicrobials going forward. It's the availability of equipment like, splints, surgical kits, infusion pumps. You get a patient with complex needs, you might need an intensive care environment. Do you have that environment? And staff that are working within these facilities, particularly the local staff, where maybe access into facilities to provide excess healthcare personnel, the staff are going to be tired and they're going to be very quickly burnt out, as well as dealing with their own stress, with their own concerns about their own families. And also what you do find is that healthcare workers flee, understandably, they're fleeing for their own safety with their own families. So then ultimately you end up with an over-reliance of healthcare facilities that are still manned. You get the destruction of healthcare facilities, which obviously then puts an increased burden on the facilities that are remaining and are still fully functioning. So, these facilities can very, very quickly become overwhelmed. And in the Ukraine, we also do have the CBRN concerns. If there's a chemical attack, there's 4 nuclear facilities as well as the decommissioned Chernobyl facility. And this just adds another layer of overwhelming concern and complexity to an already highly difficult response. So, there are so many components to this situation, and, things like burns, the ongoing care that's required. And burns is a huge speciality in itself. You've got fantastic organisation like Interburns, and that do advise countries in need, because, that's a hugely complex burns, plastics, trauma care. These are specialty areas.
So Karen, just as we come into land on the conversation, just a couple more questions around sort of governance, really, and governance frameworks in a coordinated response. How central is governance and indeed sort of retrospective analysis of targeted aid, that it makes sure it does get to the right population within Ukraine?
Yeah, so governance frameworks. So, it's very, very difficult. It's one of the things that the WHO emergency medical teams initiatives has set about doing. It's trying to provide standards and then ensuring that people are working to standards. We're all very aware of some safeguarding issues that came to the forefront within non-governmental organisations. And now, one of the key requirements is that aid workers are trained, for example, in safeguarding issues. Particularly in any crisis, you're going to be working with unaccompanied minors, young women who are vulnerable. You have the real risk of sexual and gender-based violence and child exploitation, human trafficking. So it's making sure we're all aware of these issues, that we're adequately trained, and these are things that are now sort of standards within an aid response that are expected. You've got the monitoring and evaluation of programs, which is considered hugely stepped up now, and these are things that aid organisations should have as a fundamental requirement, so that they can report on interventions. And it's ensuring, absolute basic things, that we work with local populations, that we uphold their local cultures and their standards of practice, that we don't jump in trying to apply our own principles, our own standards, and that we think that we know what's best. There are often guidelines that have been, set out by the Ministry of Health, and there will be guidelines, within the Ukraine that the Ministry of Health have set out, and it's not up to us as an international population to go in and start changing these and putting our own spin on things. It's following their codes of conduct. It's following their practices, and it's really important that we do this, and uphold the best practice within the Ukraine, or within the best practice within the surrounding countries, and that is always a real risk in aid responses, and I've seen that time and time again in responses. It was a huge problem working in Sierra Leone, to the point that some of the local healthcare workers were like, "Oh, and another team's coming in and they're trying to change the practice," and we just kept reiterating, you work within the standards of the country, and that's really important, and that's things that people can be doing now if they're thinking they're going to respond, and that they're going to be based, have an idea of where they're going to be based. They can start learning about what the local cultures and healthcare practices are, what are the local prescribing practices, and that can help inform prescribing antibiotics, prescribing of, general medications, supporting primary care and prescribing practices, for example. So, there's real key things that need to be upheld, that come under that.
So Karen, as we come into land in the conversation, just looking at take-home messages, what could people do to prepare themselves in readiness for deployment on a humanitarian mission?
I think there's a fair amount you can do to prepare yourself, and whether that be working with an organisation based within the Ukraine or working on a healthcare project that's set up in a surrounding country. There's simple things you can do. There's online courses that will help you as a healthcare professional ready to deploy within these environments. I've already mentioned preparing yourself with some security training. So there's an online free course, the UN security course, which is available free online. And if you can access a hostile environment awareness training course or something of that nature, these are courses that are normally 3 to 5 days face to face, but excellent courses of a high standard. Consider what language skills you have. Have you got a language skill that might be useful, or are you good at languages? Can you learn a language? Because these will really, really help you. And other online courses. There's on the site Open WHO. There's a range of free humanitarian training courses, as well as by an organisation called Disaster Ready, which is disasterready.org. They have numerous online free training courses, as does the Manchester-based organisation UKmed. They have a free access course, Introduction to Humanitarian Healthcare, and also looking at undertaking some safeguarding training, and, for example, ensuring that your DBS check is up to date, things like this that will help you. You probably also need to consider the organisation that you're going with. What security provisions do they provide? Because that's something that sometimes is overlooked. And I think when you're looking at working in a conflict environment, your security plan and your emergency security exit plan is fundamentally important. And what insurance does that organisation provide? For example, is your indemnity insurance covered to work within that country? Does your own personal indemnity insurance cover you? to practice in another country. And, I think these are things that are often overlooked. You can look at things like the Sphere project, which outlines the minimum standards required in a humanitarian response. And that's a manual you can actually download for free. It's also worth having a hard copy of that and making yourself familiar with these minimum standards, as well as looking at things as well, like your own mental health. Having a mental health problem yourself is not a barrier to engaging in a humanitarian response. Actually considering, is it the right time for you now to engage? Is your mental health quite stable? And being honest with the organisation that you're going in, many of them will ask you to undertake a personal health check. And don't hide the fact if you're taking medication. Don't decide to suddenly stop taking that medication. Be honest. But it's making sure that your own personal mental health is in a good place before you engage. Because the last thing you want to do is enter any of these environments and suddenly become a burden. And that's another consideration in any humanitarian response, is that you need to be going, and your team and organisation needs to be self-sufficient. And that's with food, vehicles, water, medical supplies. And it's making sure that you are self-sufficient, because if not, you're just going to deplete the already finite resources that are in those countries, and you can then actually become more of a problem yourself. So it's making sure that you've taken lots of these various things into consideration. So lots of food for thought there.
And that's fantastic. And absolutely, there's multiple things that need to be considered. And those are a fantastic selection of things. So isn't that just want to say thank you actually for the last hour of your time and your thoughts on what is very complex and protracted as the events proceed in Ukraine, but just fantastic to get your perspectives, Karen. So thank you.
No, thank you for having me. And I wish everybody that works on projects either within Ukraine, surrounding countries, or with affected populations, I wish them all the best. And like everybody else globally, we wish for a very speedy resolution to this horrendous conflict.
Thanks, Karen.
Thanks, Aaron.